Hi, welcome to Wake TV. I'm your host, Alice Avery. It's finally summertime, and that means there are a lot of things going on in Wake County. Stay tuned and we'll tell you all about it. Hi, we're here at historic Oakview County Park to talk about an exciting new program that's being launched here. I'm here with Abby Jones to talk about the program. Abby, thanks for joining us.
Sure.
So tell us a little bit about what's going on.
So this is part of a new program that we're doing called Everyone's Welcome, and it relates to the fact that our park is here for everyone, but there are certain barriers within our parks, particularly for people with sensory processing disorders, which typically is people on the autism spectrum. And so these are a program and materials that we've developed in order to assist parents and caregivers of children on the autism spectrum.
Okay, that's awesome. So do you want to go through some of the materials that we have?
Sure, so we have a couple of different resources. The big one that we have is the My Oakview Park Pack, and this is available to check out anytime during operating hours, Monday to Sunday. And the pack includes a couple of different resources. It has the My Oakview Park Pack, which is a make your own visual schedule. So there are pieces in here that relate to different locations around the park. So after kind of getting an overview of the park and everything that's available to visit, you can turn here and you can make your own schedule using whichever pieces you're interested in visiting that day. And then there's also a marker, so after you take this around your park and you've finished your first stop, you can mark it finished and then you can move on for the rest of your visit. It also includes a couple of instructions and then some tips for sensory tips that would assist people who have sensory processing issues. So there is information about places that get noisy or busy at the park, but there's also information about places in the park that are quieter and might be good if you need a break from kind of that sensory overload. And there's also a couple of activity suggestions too. So this is basically just a way to plan your visit. And then another part of the pack, it also includes a couple of resources like noise muffling headphones. So if it does get a little bit too loud, these are here to use. And then it includes some toys, some sensory seeking toys that are available as well if you need something to do with your hands. So this is certainly a way to plan your visit and make our park a little bit more accessible. Besides the park pack, which people can check out, we also have a couple of other resources. We have noise muffling headphones and other fidget toys that are available for visitors to check out whenever they're visiting the park as well, if you don't want to do the whole pack. If you're here for an event or something, these would also be available. And then lastly, we have some social narratives. So the social narratives kind of give an overview of what to expect in both pictures and in words. So they're good for kind of a variety of different ages. And they are geared towards a couple of different ways you could experience the park. So just an independent visit if you're just visiting for the day. But we also have some social narratives for our more popular programs, like our group programs, our history hike, or a school field trip as well. So these would be available for parents or caregivers or any teachers who would be interested in using these resources in their classrooms if they're coming out to visit. And so we have copies of all of these, and we have these resources available at our park, but we also have a lot of information available online, so it's available prior to your visit as well if you want to plan it that way.
And how do we find that online?
That is if you go to wakegov.com/park/Oakview, and you go to our programs page, and it's under the heading Everyone's Welcome.
Great. It sounds like this really opens up everything at the park to everyone, which is awesome.
Yeah. We're definitely trying to kind of remove those barriers and make our park more accessible to new and broader populations who perhaps had these barriers previously.
That's great. So how long has Oakview been doing this program?
This is actually a pretty new program. We've only had these resources available for a few months now, so we're certainly looking for any feedback or comments or thoughts from anyone, and if they would like to share those, we'd certainly be open to them. They can contact me either through email or phone, and that information is also on our website.
Great. What are the plans for the future?
We do have plans for the future. We're always looking for new ways to explore our accessibility and to add new resources. So we have plans to include resources for people with low vision or who are blind, or people who have hearing loss or are deaf. And those resources will include things more accessible to them, like more tactile opportunities or large print materials, things like that.
Great. Well, thanks for explaining everything to us. And like you said, for people to get started, they can go to the website, wakegov.com/park/Oakview, or stop by at the Farm History Center here and talk to one of the staff members.
Absolutely.
Okay, great. Well, thank you very much.
Thank you.
Get the timely and accurate information you need to stay safe if there's an emergency in your area. Sign up for Ready Wake alerts, and Wake County will send you important notifications by text, phone, or email, whichever way you choose. Whether it's severe weather, a missing person report, or a neighborhood evacuation, stay in the know with Ready Wake alerts. Learn more and sign up at readywake.com.
Another area in which Wake County is focusing on behavioral health is within EMS care. Today, we're joined by Dr. Jose Cabanas to talk about what's changed in the past year. Thanks for joining us today.
Thanks for having me.
So tell us a little bit about the kind of training that EMS personnel receive as far as behavioral health care goes.
Sure. So as you know, Alice, we have a very comprehensive EMS system, and our goal always is to respond to all those requests for service and to meet the needs of our community and our patients. In particular here, our mental health patients. The EMS system has a very comprehensive approach to managing mental health emergencies. We not only have first responders and have our paramedics respond to those calls, but we have specific processes and criteria to identify patients in mental health crisis that actually, and what the best location or resource they should go to get the services they need. Our providers get ongoing education, so not only when we hire a new paramedic or a new provider in the system, when they get on board, they get specific training regards to mental health emergencies, making sure to identify patients that are a danger to themselves, danger to others, and assuring that they understand how to provide the care for them in the community and what resources are available. With regards to ongoing training, we do regular what we call CE, which is continuing education. So our paramedics and our emergency medical technicians receive regular quarterly CME, and we cover a number of topics with regards to mental health to assure that we're maintaining up to date with our standards and making sure that if we implement something new or a new intervention, new treatment, that we can cycle that change and implement that new care in our community. We also have providers receive crisis intervention training, CIT training. Our advanced practice paramedics, our field training officers, and our field supervisors are all trained, certified in CIT, and that's a specific training that is tailored to identify that patient in crisis and has some strategies to try to mitigate, de-escalate, and help understand what's going on so we can actually appropriately provide the best care for the patient.
Have you seen an increase in the need for these types of services?
Oh, absolutely. As you know, Alice, we're a growing community, and with growth comes more demand for services. Understand that the EMS system number one function is to provide access to care. We respond to emergencies in the community, from a heart attack to somebody who may be having a bleeding emergency or a traumatic event. But we also, to the same level, respond to somebody who has an acute mental health crisis, and we want to make sure that we can provide the best care possible every time.
Okay. And so we're not only changing how we respond to these behavioral health calls, we're also changing how we route patients through the Enhanced Mobile Crisis Pilot Program. Can you talk a little bit about that?
Absolutely. This is a program that we are very excited about. This pilot program, it's a partnership with Alliance, with Therapeutic Alternatives, which is the mobile crisis provider in the community through Alliance, and the EMS system. And the goal for this pilot program is to identify how do we bring additional resources in our setting, in the EMS system environment, to try to better navigate patients to other options for care that not only relies on the emergency department or coming to a facility to receive additional evaluation and treatment. So the purpose of this pilot is, can we make a connection by bringing on licensed clinicians that are mobile crisis professionals and making a connection with the EMS system. So if we respond to a patient that has access to the 911 system because they believe they have a crisis, we respond to that call, we do an assessment, we start treatment, and once we identify this patient doesn't have an immediate medical complaint or medical need, we're bringing additional mental health resources, in this case, a mobile crisis licensed clinician, to do a more in-depth risk assessment, start some additional interventions, and probably connect the patient with the best resource to meet their need. Now, sometimes that resource may be outpatient follow-up treatment, for which they also provide that follow-up, or it may be that we navigate the patient to the crisis center, which we actually do now with Wakebrook, or there's patients that have to be evaluated at high level of care, and we actually navigate those to the appropriate place. But we're trying to integrate different resources into our system delivery to assure that we are providing the best care possible for our patients. So it's a pilot program. We're in the process of learning how do we make that connection, how we bring that resource to our community, and we'll be tracking data and getting feedback and learning to see if it's providing the value that we believe it brings to the community.
How long does the pilot program go on for?
So Wake County has provided funding for a 2-year cycle, and then we have a very collaborative team between Alliance, Therapeutic Alternatives, the EMS system, and we are this program is brand new, so we're just starting, and then once we have several metrics and evaluations that we're doing, and hopefully we'll get better data whether we need to expand, grow it, and things that we can improve in the program to see if we're maximizing our opportunity to provide the best service we can to the community.
Okay. Is this being done within other EMS systems across the country?
Absolutely. So there's other communities that have built a similar model. Austin, Texas is an example, and they have provided significant value and results to the community. And we have, as always, as a very innovative, forward-thinking county, we're trying to learn and trying to bring best practices and new innovative ways that we can care in our community. So this model has been implemented in other places with huge success. So we're trying to bring those new ideas into the community to maximize the care that we provide for our patients.
So in a perfect world, how would this benefit Wake County residents? So
the overarching goal is we want to make sure that when somebody has a crisis, when they're accessing the 911 system because they have an immediate need, that we're able to identify that patient accurately and navigate them to the right resource in the right amount of time to receive the care they need. And that's our ultimate goal. And this program is an additional strategy as part of a comprehensive approach to make sure that we're meeting that goal.
Great. Is there anything else you want people to know about this program or the changes that Wake County EMS is making?
Absolutely. At any time you can reach out to us or Alliance or Therapeutic Alternatives for any questions, concerns, feedback if you have interactive with our EMS system. So far, the very preliminary feedback we received from the community has been very good feedback. So please, at any time, reach out to us, to our EMS system, for any information, questions, or any thoughts you want to share with us.
Great. Well, we look forward to hearing about how this goes.
Absolutely. Yeah. Thanks so much for having me, and we're very excited about this project.
Thanks for taking the time to stop by.
Anytime.
The Wake County WIC program is excited to announce a major new development for the distribution of WIC benefits. eWIC offers a simple, safe, and convenient way for WIC clients to use their food benefits. The brand new eWIC cards replace paper food vouchers and work just like debit cards at the checkout. When you get to the register, swipe your eWIC card first to pay for WIC allowed foods. For the first time, eWIC allows clients to buy as little or as much food as they need during each shopping trip. You can even check your benefit balance and identify WIC-approved products on your smartphone while you shop. To learn more about eWIC, please call 919-250-4720 or visit wakegov.com/WIC.
Even though people have been recycling for years, there's still some confusion around what actually can and can't be recycled. Wake County recently conducted a landfill mix study. Here's John with more.
Hi, I'm John Hamlin, and we're here at the South Wake Landfill, where we're doing a waste characterization study. I'm here with Solid Waste Outreach Manager Bianca Howard, and could you just tell us what's going on today?
We are really excited about our waste characterization study. This is going to give us a snapshot of what people in Wake County are throwing away.
Okay, and so explain to us how this is working. There are people, I believe, going through the trash.
That's exactly right. We've worked with a consulting firm to find samples that represent the county's waste. So we're pulling 50 samples from residents and businesses and institutions around Wake County. We're working with people who are actually sorting it into 49 different categories, and then the results will be analyzed to give us an idea of what people are throwing away, and particularly what we're throwing away that could have been recycled or composted.
So 49 categories. It sounds like y'all are getting pretty specific.
We are. We really want a nuanced view of what people are throwing away, because that'll inform us and give us an idea of how well our municipal and commercial recycling programs are working. So we don't want to just know what kind of plastics people are throwing away. We want to know what plastic bottles or what other recyclable plastics people are throwing away, because that really gives us a better idea of how well our recycling education programs are working and where they could be improved.
Okay, and so this trash is coming from all over the county?
That's exactly right. We are looking for samples from all around the county to give us an idea of what people are throwing away. We know that our county has some cities as well as some rural parts, and by pulling samples from different routes, we can get a more accurate picture of what residents and businesses are generating and sending to the landfill.
Okay, and so what will we do with this information once the study is done?
Well, studies like this have been done in the past, and they're used to inform our solid waste policy. For example, looking at what people throw away will give us an idea of how well our recycling education programs are working. It'll also help us identify things that perhaps could be diverted from the landfill. Then that'll give us ideas about new recycling programs or new reuse programs that we might want to consider. Because it's a county-wide study, we'll be sharing this data with our municipal partners, and it'll also give them information they can use as they make decisions about how to collect and manage solid waste for the future.
Okay, so now that we've been digging through the trash for a few days, have there been any interesting or surprising finds?
There have. We have found some potter's clay. We've also found a whole collection of paint can lids, not the cans themselves, just the lids, and some very colorful remains of paint. We've also found some interesting things, such as some pristine baseball magazines from the early 90s.
Wow. Wonder why someone would throw that away.
There's no telling. But there's also just sort of ordinary things that you might expect to see every day. Pillows, coat hangers. We're particularly interested in plastic bottles and cans, things that could have been recycled, but for some reason were not.
Okay, and so when can we expect to learn the results to the study?
The results of the study should be available in June, and we'll definitely be making them available to our municipal partners. We'll also be putting information on our website so that citizens can read and understand what we learned. If people are interested, they can also see results of previous studies. Our most recent study before this one was done in 2011, and we do have that report available on our website, and we'll also use that in presentations.
All right, well, thank you, Bianca. We look forward to learning the results of that study and learning how we here in Wake County can keep more things out of the landfill.
Are you hosting an event but don't have a convenient way to collect trash and recycling? Wake County is excited to announce a new event recycling program that's free for residents. Whether you're hosting a private event, wedding, neighborhood party, or even a festival, these portable stations include composting, recycling, and trash bins. To learn more about how you can reserve an event recycling station for your next gathering, visit wakegov.com/event recycling.
One of the hardest things about summer for children in our community who are less fortunate is the lack of subsidized lunches. Each year, Wake County partners with other organizations to offer a summer food program. Here's Andrew with details.
Hi, I'm Andrew Sawyer. Summer's just beginning here in Wake County, and we're here at Oakview County Park with Sydney Klein from our food security program. Sydney, can you tell us a little bit about one of our biggest programs in the summer here in Wake County, and that's our summer food program?
Yeah, so the summer food program has been going for several years. Last summer we served about 250,000 meals. Any child up to the age of 18 can go and get a free meal during the summer. And what's great about the last few years is we've really been trying to build the activities portion of that. So there's also activities where the kids can go and participate in other things beyond just a meal.
Great. What dates do the summer food program begin and end?
So it starts on June 17th. Some of the sites are going to go into the first couple of weeks of August. It depends on the site. So the best way to find that out is to visit the site on the first day, and then they can give you their schedules.
And where are sites located throughout our county?
So we have sites at our regional centers. We have them at community parks, churches, nonprofits. There really can be anywhere that's in an eligible zone. Our human services centers are at the Sunnybrook Center in Raleigh, in Fuquay Arena, we have the Southern Regional Center. In Wake Forest, we have the Northern Regional Center, and in the east, we have the Eastern Regional Center in Zebulon.
Why is it so important for Wake County to do summer meals?
So during the summer months, the children that would typically get the free and reduced lunch don't have access to that meal, and it's a really important meal. So sites can serve breakfast, they can serve lunch, or they can serve dinner. So it just helps supplement a child's nutrition during the summer.
And community partnerships are very valuable in this program. Can you talk a little bit about that?
Yeah, so we've been working through several work groups to bring in both county partners, community partners, so that could be churches, parks and recs, city and municipal staff, and just really passionate volunteers to help support activities at the sites, outreach and marketing, and to serve the meals, and also potentially fundraise to feed the parents as well. So we've really formed some strong partnerships this year, and I'm looking forward to building on those.
And where can I go if I want to learn more about the summer food program, or possibly to get my organization involved in helping kids this summer?
Yeah, so you can go to wakegov.com/summerfood, and that's a good starting place. If you have more questions about becoming a site or a sponsor, where you could find a site, you can email summerfoodprogram@wakegov.com, and we can answer your questions.
Great. I think we're all looking forward to a wonderful summer of helping kids out throughout our community with summer meals. Thank you.
Thank you.
Only 1 in 5 people recycles in their bathroom, so Wake County is making it easy to get started. If you sign up for our bathroom recycling initiative and agree to take a survey, we'll give you a free 3-gallon recycling bin for your bathroom while supplies last. For more information, visit the website on your screen.
There's nothing quite like going to the pool on a hot summer day. Here in Wake County, we do a lot to make sure the public pools in our county are safe, but there are things that you need to do as well. Here's John with more.
Hi, I'm John Hamlin, and we're here at the Greenway Club with Jessica Sanders, who oversees Wake County's pool program. And she's here to tell us about everything that the county does to make sure that everyone has a fun and safe summer at the pool.
Hi, John. So we have about 60 inspectors out this time of year doing opening inspections for the 1,230 pools that we have here in Wake County.
Okay, so that's a lot of pools. How do y'all make sure that everyone gets inspected?
Well, after April 1st, the operators start calling us requesting an inspection and saying that they're ready for their pool to be inspected, and we go out and do an inspection. And if everything is found compliant, then they'll be issued an operating permit which allows them to open.
Okay, so what all goes into a pool inspection? What are y'all looking for?
We look for critical items such as safety equipment, emergency phone. We also check the pool chemistry and clarity to be able to see the bottom of the pool. We check the barrier of the pool, the fencing, the gate to make sure it has a good closure on it, as well as restroom facilities and the pump room.
So you all make sure that everything's okay from a maintenance side at the pool, but there's still a lot that swimmers need to do to make sure that everyone stays healthy too.
Yes, swimmers need to make sure that they are healthy before they swim in a pool as well, and to not swim when they've not been feeling well, and to make sure they take frequent bathroom breaks and to shower before they enter the pool.
Well, thank you, Jessica. That was great information, and we all look forward to getting out and having a great time at the pool this summer.
Hi, we're here with Katrina Vernon with Wake County Public Libraries at one of the county's biggest and most popular events of the year. Katrina, thanks for joining us.
Thanks for having me.
So tell us a little bit about what's going on behind us.
Sure, so this is Wake County Public Library's annual book sale. We host this once a year, the first weekend in May, and today's the first day of the book sale. We're really excited this year because we were able to open at noon instead of at 5 when we typically open on the first day. And as you can see, it's a huge success. We've had crowds all day, we had a huge line. We saw people starting to line up at 9:30 this morning, so it's been a great day already.
Wow, so how many books are here and what kind of books do you have?
Yeah, so this year we have about 205,000 books. And we have books of all types, children's books, adult fiction, nonfiction, different genres, cookbooks, arts and crafts, foreign language. So we really try to have a little bit of everything and tailor it to what we know that people like to buy at the book sale. And a huge collection for us is the children's collection. That is one of our most popular areas during the sale.
And we do see a lot of kids that are here right now looking through the books.
Absolutely. This morning we actually had a 1-week-old who was here.
Aww.
So that was our youngest visitor so far.
You're never too young to start
That's
reading.
right, absolutely.
So go over the hours that you're going to be open for the rest of the weekend.
Yes, so today we are open until 9 o'clock. And then both Friday and Saturday, we open at 9 in the morning and we're open until 9 at night. Sunday, our final day of the sale, we open at 9 and we're open until we sell out or until 6 p.m., whichever one happens first.
That's great. Do you usually sell out before 6 p.m.?
We do. The last couple of years we have sold out, and so we've closed a little bit early.
That's great. So it takes a lot of people to run something of this magnitude. Who are the people that are making this happen?
Yes, it takes a huge number of people. So library staff is here. They are helping work the sale, cashier, count books, set up the sale. We have our community services administration here. They're the ones who are helping us with all the financial aspects. And then we have lots and lots of community volunteers. So we have about 170 volunteers this year who are coming here to spend their time at the sale with us.
It's a great team effort.
It is.
So where does the money go that you're raising from the sale of all these books?
Yes, so the money all goes into Wake County's general fund, which then comes back to the libraries, but it also supports all the different departments within Wake County government. And last year we raised upward of $100,000.
Wow, that's great.
Yeah.
So if people are headed out here, what are some things that they need to know? Do they need to bring their own boxes or hand carts? Or
Great question, yes.
Pro tips.
So we have boxes here, and we typically do not run out of boxes. We also have hand carts, but we have a limited supply. So if people have carts, if people have wagons, if people have suitcases, we encourage all of those things because it will just make it easier for them. This place is huge. There are a lot of books, and people often spend a couple of hours here. So comfortable shoes and some water are also good things to bring.
Awesome. Well, we hope it's a success and that everything keeps going great.
Thank you so much.
Yeah, thanks for joining us.
Yes.
That's all for this episode of Wake TV. Keep up with all the latest Wake County news by visiting us online at wakegov.com/news, and be sure to follow us on Facebook, Instagram, Twitter, and YouTube so you can always stay in the loop. We'll see you next time.